Hi, I am Dr. Felice Gersh, your integrative OBGYN physician, speaking to you about the role of estrogen, and I'm going to tell you what estrogen I mean, and Alzheimer's disease. I have talked endlessly about this topic with my patients. In fact, just today in my office, I had a patient come in dealing with issues that were brought up when she went to have a mammogram, and her mammogram technician brought up the issue of the article that I'm going to talk about in a minute and saying, what on earth are you doing? You're on hormones. Don't you know that being on hormones in menopause can give you Alzheimer's disease, not to mention breast cancer and all kinds of other problems, blood clots, heart attacks, strokes. So she came in saying, maybe I shouldn't be on hormones. So I had to sit down and just explain to her what hormones do, the kind that I prescribe, and then let her make up her own mind, which she decided based on the information I gave her and what her own goals were to continue taking the human bioidentical hormones that I use and would only use. So let's backtrack to this article, the one that my patients, this one and others, have come in to discuss with me because they're so concerned. Well, if you look at the headlines and then you look at the actual data, it can also be a little confusing to people. So it was a small study that was done in Wisconsin and went from 2006 to 2021, and it was based on patients giving their own history. So it was not a prospective study in the sense that, it was placebo double-blinded, but they went ahead and they looked at very interesting data where they did special types of positron imaging of the brains of all of these individuals. There were men and there were women. And what they looked at was tau deposits in the brain, which are associated, particularly when involved with amyloid beta deposits, with a higher risk of Alzheimer's dementia. So what did they find? They found that the women had more of this tau protein that causes tangles that when combined with amyloid protein is associated, as I mentioned, with Alzheimer's disease. So women had more of this tau protein than did men. Now, at the beginning of this study, no one tested for having cognitive dysfunction. So what did they find when they looked at hormones and who took hormones and so on? What they found was that women who started taking hormone replacement therapy, and I'm going to tell you what kind of hormone replacement therapy, that the women who started late in their menopausal life, that they had more deposits of this tau protein, which did not prove that they developed Alzheimer's. They did not test them for developing Alzheimer's, just with the imaging study for the presence of tau protein. They also found that women who had an earlier onset of menopause before the age of 45 also had more of these deposits. And women who started on hormones earlier did not. They also found that women who develop Alzheimer's and go on hormones only seem to develop Alzheimer's if they already had pre-existing deposits of tau at the time they went on these hormones. But what hormones did they use? They used non-human hormones. They used the conjugated equine estrogens and the medroxyprogesterone acetate that was used in the Women's Health Initiative that was ended over 20 years ago now, that formed the foundation of the massive amounts of fear that have existed in the last 20 years about the use of hormones in menopausal women. So these particular products are called hormones, but I hate the use of the word hormones for these products because they are never found naturally in any human being ever. So the conjugated equine estrogens, they are from a pregnant horse's urine. This particular type of estrogen has gone through the liver, been conjugated. So that's a metabolic process that occurs in the liver to transform the estrogens from a fat-soluble status to a water-soluble status so that they can be eliminated in the urine. And it included a fake mimic, a very negative, very bad for women mimic of progesterone, not human progesterone, but a mimic called MPA, medroxyprogesterone acetate, which is a different molecule and has really negative effects. This has been shown over and over. Most of the negative outcome actually came, not all, but much of it came from the use of this pretend, like the evil twin of progesterone. Now, there's nothing evil per se about conjugated equine estrogens. They're just a natural product of a pregnant horse getting rid of old estrogen that she doesn't want to have anymore in her body. But none of that is ever found in a human. It includes what we call equine or horse types of estrogens. And then they take the urine, they dry it up, they make it into a tablet, and then they give it to human women in menopause. Well, many, many years ago, this is all they could come up with because they didn't know how to manufacture human bioidentical estradiol. Estradiol, the estrogen that's produced in ovaries of reproductive age women. It's a totally different molecule. It's a different product altogether. But if you give this horse product that the horse is trying to get rid of to a human, it will suppress night sweats and hot flashes, and surprisingly can even have some benefits, interestingly enough. Much of the estrogen that does get into the human body when they swallow these conjugated equine estrogens is converted into estrone. Estrone is an estrogen that binds predominantly, almost exclusively, to one and one only type of estrogen receptor called alpha. Well, it turns out that the brain of a human has different estrogen receptors in different parts. And estrogen is not a hormone. It's a family of hormones, the estrogens. Just like there is no B vitamin, B vitamins are a family of B vitamins. And there's B1 through B12. They each have a number and they each have a name. The same thing for human estrogens. There are 4 of them. The last one, E4, is primarily a fetal estrogen. We're not going to even talk about that one. The others are E1, which is estrone, E2, which is estradiol, the full name, 17-beta estradiol, and then E3, which is estriol, the dominant estrogen produced by the placenta in pregnancy. And there are 3 types of estrogen receptors. There's alpha, beta, and a membrane receptor that is GPERS. I call it Jeepers, okay? And these receptors, when they bind to different estrogens, they have different effects. And they affect each other. Like if you have a lot of beta binding, it downregulates alpha. So there's an interaction, and it's designed for when women are reproductive aged and for pregnancy. It's not really designed for menopause because there's no great design for menopause. But in menopausal women, they do not have estradiol being produced from their ovaries. The only estrogen they have is predominantly estrone that's produced in fat tissue. The dominant estrogen of menopause is estrone, which binds to alpha receptor. When you give conjugated equine estrogens, you get the horse types of estrogens plus predominantly estrone, just like a menopausal woman, estrone. You do not get much estradiol. Everywhere in the body, including the brain, has estrogen receptors, but the predominance of the different types of receptors vary with different organs and different parts of the organs. So, for example, in the GI tract, the lining cells are predominantly beta receptors. In arteries, it's predominantly alpha. Certain immune cells, like the innate immune cells, like macrophages, monocytes, neutrophils, mast cells, are predominantly alpha. The B cells, the B lymphocytes that make antibodies, are predominantly beta. Nothing's exclusive. And in the brain, the hypothalamus that controls temperature, like hot flashes would be an issue, and also other regulations of the body involving reproduction, a lot of reproductive issues, that is predominantly alpha. The cerebrum, which is where you have the higher level thinking, that is predominantly beta. Now, remember, if you take conjugated equine estrogens, that's what they used in this study, as they did in the Women's Health Initiative, you're predominantly going to be activating the alpha receptor. And there's not much of that at all in the cerebrum, the area of cognition. So, when you give those types of hormones, particularly into an older woman, which is what they did in the Women's Health Initiative, the average age was 63. And in this recent study, the women who were older at the time that they started this particular hormone concoction or cocktail, not human hormones, but the horse conjugated equine estrogens and this evil mimic of progesterone, MPA, medroxyprogesterone acetate, if you gave that to older women, then guess what? You didn't do well. In that group, you actually increased dementia. Now, why is that? Once again, it doesn't bind to the beta receptor, which is the part of the brain in the cerebrum that deals with cognition. It only binds to alpha. So the poor brain needs estradiol to maintain proper health of neurons. When you have estradiol and you activate the beta receptor in the cerebrum, you have neurogenesis. That means you create new neurons. You have neuroprotection, which means you protect the neurons that are there, and you increase synapse function, so you have better connectivity between the neurons. In addition, estradiol helps promote the production of acetylcholine. That's a neurotransmitter that seals memories. Serotonin, the neurotransmitter that makes you feel happy and calm. And from that comes melatonin, so you sleep better. And we know how important sleep is for brain health and function. So that's not going to happen if you don't have activation of the beta receptor, which you're not going to get from taking conjugated equine estrogens or the estrogen estrone that's dominant in menopausal women made from adrenal precursor androgens in fat tissue. Now, here's another problem. If you have a lot of inflammation in your body, which older postmenopausal women have, not so much right at the beginning of menopause or perimenopausal women are not going to be so inflamed if they're otherwise healthy. But when you have inflammation, it downregulates the enzyme that helps to convert estrone into estradiol. So in a younger woman, if you give conjugated equine estrogens, which dominantly will go into the blood as estrone, you still have the functioning enzyme to help convert to more estradiol, which can then activate the beta receptor in the cerebrum to improve cognition and maintain health of neurons and control the immune system so it doesn't create crazy, wacky, out of control, damaging inflammation. So what's the takeaway from this recent study? Don't give conjugated equine estrogens to older women. Best yet, don't use it at all. Use estradiol and give it through the skin, what we call transdermal, so it doesn't get converted in the liver by taking it through the mouth and going through the digestion into the liver into estrone, which will happen even if you take an oral estradiol pill. It goes into the blood as estrone, which we do not want, okay? It's still beneficial in young, early onset of menopausal women because they're not yet so inflamed and they can convert a lot of the estrone into estradiol, but that's going to go away. So best to give what is best, human bioidentical transdermal estradiol and progesterone, real human progesterone made in the ovaries. By the way, the brain even makes progesterone and estradiol. They just can't always make enough Those are, when they're made in the brain, they call them neurosteroids. That is why these hormones are neuroprotective. They're so important for brain health and brain function. So progesterone, real ovarian-produced progesterone, which we can give as a medication in postmenopausal women, because brilliant people learned how to make it so that it can get into our systems and not be digested. That's why we call it micronized when we give it orally. And then we have real progesterone, real estradiol, and progesterone, by the way, is also neuroprotective. If you give these hormones and you start at the very beginning of menopause, or even better yet, during the perimenopause or transition stage, because remember, menopause isn't like crossing a finish line, it's a journey. And the journey begins years before the last period. That's like late stage in this journey. We want to start early. Early is best. The takeaway is just that. Start hormones early and use human bioidentical hormones, because if you use the stuff from a horse, the stuff that's never found in a human body, you're not going to get the same benefits. But interestingly, even if you give the wrong stuff, but you give it early enough in menopause, you still get some benefit. But don't do that. Use real human bioidentical hormones, estradiol and progesterone. Get it to physiologic, like normal levels that a woman would have approximately. And when you do that, the brain, which has these really critical need for these hormones and has receptors for these hormones, those receptors will fill with the right hormone and the cells will do the right thing to maintain great brain health, great cognition, and lower the risk of dementia, vascular, and Alzheimer's. Hormones are great, but we have to use the right kind, and best when we start them early. So don't panic. If you're on hormones, discuss it with your personal physician, and know that we didn't get ovarian hormone production to give us dementia. We have a great need for hormones to maintain brain health, brain function. And so that is the real story. Take care.